When this cat entered a patient's room, it predicted something incredibly strange. A shy cat suddenly entered a patient's room, and the staff knew something strange was about to happen. Oscar's behavior within hours of someone's demise was so different that the hospital staff used to call in the family members of patients. As soon as they noticed the cat starting to get friendly and cuddly with them. How did Oscar know? At Steerhouse Nursing and Rehabilitation Center in Providence, Rhode Island, Oscar the therapy cat became well known for doing just that. In fact, geriatrician and Brown University health researcher Dr. David Doser, who worked with Steerhouse patients and saw Oscar in action, wrote a book about the fluffy piebald cat's outstanding skills. Dr. Doser told Crossroad Hospice that when Oscar arrived at Steerhouse in 2005, he was not very social with the patients. Oscar was initially a very scared cat. Oscar would prefer not to come out. Oscar kept to himself. You could often locate him in the supply closet or under a bed. But once in a while, Oscar would home in on a specific patient, visiting with them in their room and even cuddling up to them in bed. Cats are known to be picky, so a shift in behavior wouldn't be surprising, but staff soon saw a trend building. After doing this multiple times, staff discovered that the folks he was staying with were frequently the next to go, Dr. Doser explained. One demise followed by two, and eventually he hit around 20 or 30 demises in a sequence, at which point everyone began to think, wow, this is rather interesting. Oscar's behavior within hours before someone's demise was so exactly anticipated that staff started summoning in the family members of residents as soon as they spotted the cat starting to get comfortable and fuzzy with them. Dr. Doser described what Oscar's behavior looked like in a 2010 video. When Oscar makes his rounds, he walks around the unit, checking in on the 40 or so patients on the floor, he said. He only remains with those who are truly nearing the end of life. He will enter a room, hop onto the ledge, and sit there for hours. He may occasionally leap on the bed and cozy up next to a patient, being there till the end. The staff members were initially skeptical, as Dr. Doser stated, it's not something you see every day, yet this was really unremarkable behavior in every other way. However, a family member of a resident who passed with Oscar by their side provided an insight into Oscar's unique ability. It's not that we trusted the cat more than the nurse. He seemed so convinced of what he was doing. He was so clear in his intention and his dedication. I believe your guess is as good as mine, Dr. Doser told Crossroad Hospice in 2016. It's possible that he's reacting to a smell as cells break down. According to research, both cats and dogs can detect illness and disease in humans, and Oscar may have had an especially strong nose for chemical changes during the demise process. Whatever it was, he felt driven to lend his companionship during someone's final hours. Oscar perished in 2022, having spent 17 years soothing passed-away individuals at Steerhouse. David Doser, MD's book Making Rounds with Oscar, The Extraordinary Gift of an Ordinary Cat tells you more about him and his talents. Cats are known for being attuned to human emotions. They may pick up on cues such as stress, sadness, or anxiety in patients and respond with affection or by seeking to comfort them. Therapy cats are specifically trained to provide companionship and emotional support to patients in hospitals, nursing homes, and other healthcare settings. Cats often have a calming presence and can help to create a peaceful atmosphere in healthcare environments. Their gentle purring and relaxed demeanor can help reduce tension and promote relaxation for patients. Cats may also demonstrate an instinctual alertness to changes in their environment, including changes in a patient's condition. Some cats have been known to exhibit behaviors such as staying close to a patient who is ill or acting differently when they sense that something is wrong.